Hi friends, I am Karan Goyal and I've been an IBS patient for more than 3 years, and today I'm going to talk about my IBS journey, how I have tackled IBS and how you people can benefit from my experience of dealing with IBS. So why does IBS occur? Basically, IBS can occur at any age. There is no age factor related to IBS, and this basically happens due to poor lifestyle and consuming too much of fast food and food with too much of spice. So I had my first trigger of IBS around 4 to 5 years back, which usually started with stomach cramps, and it got cured by taking few allopathic medicines. But after 4 to 5 months after later taking those medicines again, when I had stomach cramps, taking the allopathic medicines did not help me much. So I shifted to ayurvedic treatment, and ayurvedic treatment helped me a lot in curing IBS, but not completely. Today I'm going to tell you about what factors were beneficial for me in treating IBS. So we'll talk about those factors in detail. So now I'm going to talk about the stepwise guide how you can deal with IBS. So if your condition is more than a year longer, then I would suggest you should consult your doctor about getting an endoscopy done, because what happens in most of the cases that it is not the IBS that is causing you the problem. It can be sometimes stomach ulcers or any stomach related issue which is causing you trouble. So if your doctor hasn't suggested you to get an endoscopy done, I would suggest you either change your doctor, and if you want the details of my doctor, you can comment down below. I can let you the details of my doctor. Next thing is nabhi or dharan or navel displacement. So this happens in most of the cases. It has seen that IBS happens because of displacement of navel. So it is very important for balancing your navel as well. So there are practitioners who can correct your navel, and some of the Ayurvedic doctors also, their specialization in balancing your navel displacement. So now if you have tried the above two methods, the next important thing is diet. So you have to first figure out what kinds of foods are causing you trouble, and you have to eliminate all those foods from your diet. Like in my case, I used to have trouble eating rajma, chana, anything made from maida, all kind of carbonated drinks, and pizza, pasta. All these foods used to cause me trouble, and basically after eliminating these foods, I shifted to eating completely home cooked food, which was easy on my stomach. Along with that, I would suggest you try and consume smaller portions of meal. Basically this will help you not to overburden your stomach, and it will be easy for you to digest whatever you eat. And the next important thing is try consuming some pomegranate, and try eating fruits, vegetables, all kind of green foods are very much good in IBS. But it is seen that certain patients have a tendency to not digest certain kind of green leafy vegetables. So it is up to you whether you have to figure out what kind of food does suits you and what kind of food doesn't. So the next important thing is medicines. If you are an IBS patient, you must have taken allopathic medicines. But if those allopathic medicines are not helping you, then I would suggest that you shift on to completely Ayurvedic treatment. You can find out a good Ayurvedic doctor who has a good experience in Ayurveda, and you can try using Ayurvedic medicine. Right now, I have stopped using any allopathic or Ayurvedic treatment. Sometimes when I have IBS trigger, I keep a bottle of Zandu Pancharist syrup with me, and I take a dose of that medicine whenever I feel any kind of trouble with my stomach. So the next important point is maintaining your biological clock, and this is one of the most less talked over topics in treatment of IBS, and it is one of the important topics, I would say, because what is seen in most of the IBS patients is that their daily routine and their daily lifestyle is very messed up. People are staying awake very late at night, and they are not having a sufficient amount of sleep. In dealing with IBS, you have to be careful of that thing, and you have to maintain at least 8 hours of sleep every day, and you have to take care of that you get back to sleep at same time every day, and try to wake up early in the morning at same time. And along with that, it is also important to consume meals at the same time each day regularly, because it is seen in most of the IBS patients that people with not having meals at proper time, or their meal intake is also not proper. These people have problem with their stomach, and they have digestion issues as well. So the next important point in the stepwise guide is exercise. So exercise is basically the most important point. So what I have seen is that people having IBS, their routine, as I have mentioned before, is like not regular. But if they have a healthy lifestyle of going to exercise daily, and in exercise also, yoga is very beneficial in IBS patients. I have started with few of the yogic postures which helped me in curing my IBS, and I'm going to post down that link in the description section below, so that you try to adapt that in your lifestyle, because exercise is very, very important in IBS. And trust me, if you're exercising regularly and if you follow all of those steps, you're going to treat your IBS very soon, and within 3 months, 4 months, you'll feel better. Thank you for watching this video.